Chiropractic is a form of alternative medicine mostly concerned with the diagnosis and treatment of mechanical disorders of the musculoskeletal system, especially the spine. Proponents claim that such disorders affect general health via the nervous system. These claims are not backed by any evidence. The main chiropractic treatment technique involves manual therapy, especially spinal manipulation therapy, SMT, manipulations of other joints and soft tissues. Its foundation is at odds with mainstream medicine, and chiropractic is sustained by pseudoscientific ideas such as subluxation and innate intelligence that are not based on sound science. Numerous controlled clinical studies of treatments used by chiropractors have been conducted, with conflicting results. Systematic reviews of this research have not found evidence that chiropractic manipulation is effective, with the possible exception of treatment for back pain. A critical evaluation found that collectively, spinal manipulation was ineffective at treating any condition. Spinal manipulation may be cost-effective for subacute or chronic low back pain, but the results for acute low back pain were insufficient. The efficacy and cost-effectiveness of maintenance chiropractic care are unknown. There is not sufficient data to establish the safety of chiropractic manipulations. It is frequently associated with mild to moderate adverse effects, with serious or fatal complications in rare cases. There is controversy regarding the degree of risk of vertebral artery dissection, which can lead to stroke and death, from cervical manipulation. Several deaths have been associated with this technique, and it has been suggested that the relationship is causative, a claim which is disputed by many chiropractors. Chiropractic is well established in the United States, Canada, and Australia. It overlaps with other manual therapy professions, including massage therapy, osteopathy, and physical therapy. Most who seek chiropractic care do so for low back pain. Back and neck pain are considered the specialties of chiropractic, but many chiropractors treat ailments other than musculoskeletal issues. Many chiropractors describe themselves as primary care providers, but the chiropractic clinical training does not support the requirements to be considered primary care providers, so their role on primary care is limited and disputed. Chiropractic has two main groups: straights, now the minority, emphasize vitalism, innate intelligence and spinal adjustments, and consider vertebral subluxations to be the cause of all disease. Mixers, the majority, are more open to mainstream views and conventional medical techniques, such as exercise, massage, and ice therapy. D. Palmer founded chiropractic in the 1890s, after saying he received it from the other world, and his son B.J. Palmer helped to expand it in the early 20th century. Throughout its history, chiropractic has been controversial. Despite the overwhelming evidence that vaccination is an effective public health intervention, among chiropractors there are significant disagreements over the subject, which has led to negative impacts on both public vaccination and mainstream acceptance of chiropractic. The American Medical Association called chiropractic an unscientific cult in 1966 and boycotted it until losing an antitrust case in 1987. Chiropractic has had a strong political base and sustained demand for services. In recent decades, it has gained more legitimacy and greater acceptance among conventional physicians and health plans in the United States. Conceptual basis. Philosophy. Chiropractic is generally categorized as complementary and alternative medicine, CAM, which focuses on manipulation of the musculoskeletal system, especially the spine. Its founder, D. Palmer, called it a science of healing without drugs. Chiropractic's origins lie in the folk medicine of bone setting, and as it evolved it incorporated vitalism, spiritual inspiration, and rationalism. Its early philosophy was based on deduction from irrefutable doctrine, which helped distinguish chiropractic from medicine, provided it with legal and political defenses against claims of practicing medicine without a license, and allowed chiropractors to establish themselves as an autonomous profession. This straight philosophy, taught to generations of chiropractors, rejects the inferential reasoning of the scientific method, and relies on deductions from vitalistic first principles rather than on the materialism of science. However, most practitioners tend to incorporate scientific research into chiropractic, and most practitioners are mixers who attempt to combine the materialistic reductionism of science with the metaphysics of their predecessors and with the holistic paradigm of wellness. A 2008 commentary proposed that chiropractic actively divorce itself from the straight philosophy as part of a campaign to eliminate untestable dogma and engage in critical thinking and evidence-based research. Although a wide diversity of ideas exist among chiropractors, they share the belief that the spine and health are related in a fundamental way, and that this relationship is mediated through the nervous system. Some chiropractors claim spinal manipulation can have an effect of a variety of ailments such as irritable bowel syndrome and asthma. Chiropractic philosophy includes the following perspectives. Holism assumes that health is affected by everything in an individual's environment. Some sources also include a spiritual or existential dimension. In contrast, reductionism in chiropractic reduces causes and cures of health problems to a single factor, vertebral subluxation. Homeostasis emphasizes the body's inherent self-healing abilities. Chiropractic's early notion of innate intelligence can be thought of as a metaphor for homeostasis. A large number of chiropractors fear that if they do not separate themselves from the traditional vitalistic concept of innate intelligence, chiropractic will continue to be seen as a fringe profession. A variant of chiropractic called naturopathy originated in Chicago in the early 20th century. It holds that manual manipulation of soft tissue can reduce interference in the body and thus improve health. Straights and mixers. Straight chiropractors adhere to the philosophical principles set forth by D.D. and B.J. Palmer, and retain metaphysical definitions and vitalistic qualities. Straight chiropractors believe that vertebral subluxation leads to interference with an innate intelligence exerted via the human nervous system and is a primary underlying risk factor for many diseases. Straights view the medical diagnosis of patient complaints, which they consider to be the secondary effects of subluxations, to be unnecessary for chiropractic treatment. Thus, straight chiropractors are concerned primarily with the detection and correction of vertebral subluxation via adjustment and do not mix other types of therapies into their practice style. Their philosophy and explanations are metaphysical in nature and they prefer to use traditional chiropractic lexicon terminology, e.g., perform spinal analysis, detect subluxation, correct with adjustment. They prefer to remain separate and distinct from mainstream health care. Although considered the minority group, they have been able to transform their status as purists and heirs of the lineage into influence dramatically out of proportion to their numbers. Mixer chiropractors mix diagnostic and treatment approaches from chiropractic, medical and/or osteopathic viewpoints and make up the majority of chiropractors. Unlike straight chiropractors, mixers believe subluxation is one of many causes of disease, and hence they tend to be open to mainstream medicine. Many of them incorporate mainstream medical diagnostics and employ conventional treatments including techniques of physical therapy such as exercise, stretching, massage, ice packs, electrical muscle stimulation, therapeutic ultrasound, and moist heat. Some mixers also use techniques from alternative medicine, including nutritional supplements, acupuncture, homeopathy, herbal remedies, and biofeedback. Although mixers are the majority group, many of them retain belief in vertebral subluxation as shown in a 2003 survey of 1,100 North American chiropractors, which found that 88% wanted to retain the term vertebral subluxation complex, and that when asked to estimate the percent of disorders of internal organs, such as the heart, the lungs, or the stomach, that subluxation significantly contributes to, the mean response was 62%. A 2008 survey of 6,000 American chiropractors demonstrated that most chiropractors seem to believe that a subluxation-based clinical approach may be of limited utility for addressing visceral disorders, and greatly favored non-subluxation-based clinical approaches for such conditions. The same survey showed that most chiropractors generally believed that the majority of their clinical approach for addressing musculoskeletal/biomechanical disorders such as back pain was based on subluxation. Chiropractors often offer conventional therapies such as physical therapy and lifestyle counseling, and it may for the lay person be difficult to distinguish the unscientific from the scientific. Vertebral subluxation. Palmer hypothesized that vertebral joint misalignments, which he termed vertebral subluxations, interfered with the body's function and its inborn ability to heal itself. D. Palmer repudiated his earlier theory that vertebral subluxations caused pinched nerves in the intervertebral spaces in favor of subluxations causing altered nerve vibration, either too tense or too slack, affecting the tone, health, of the end organ. D. Palmer, using a vitalistic approach, imbued the term subluxation with a metaphysical and philosophical meaning. He qualified this by noting that knowledge of innate intelligence was not essential to the competent practice of chiropractic. This concept was later expanded upon by his son, B.J. Palmer, and was instrumental in providing the legal basis of differentiating chiropractic from conventional medicine. In 1910, D. Palmer theorized that the nervous system controlled health. Physiologists divide nerve fibers, which form the nerves, into two classes, afferent and efferent. Impressions are made on the peripheral afferent fiber endings. These create sensations that are transmitted to the center of the nervous system. Efferent nerve fibers carry impulses out from the center to their endings. Most of these go to muscles and are therefore called motor impulses, some are secretory and enter glands, a portion are inhibitory, their function being to restrain secretion. Thus, nerves carry impulses outward and sensations inward. The activity of these nerves, or rather their fibers, may become excited or allayed by impingement, the result being a modification of functionality, too much or not enough action, which is disease. Vertebral subluxation, a core concept of traditional chiropractic, remains unsubstantiated and largely untested, and a debate about whether to keep it in the chiropractic paradigm has been ongoing for decades. In general, critics of traditional subluxation-based chiropractic, including chiropractors, are skeptical of its clinical value, dogmatic beliefs, and metaphysical approach. While straight chiropractic still retains the traditional vitalistic construct espoused by the founders, evidence-based chiropractic suggests that a mechanistic view will allow chiropractic care to become integrated into the wider healthcare community. This is still a continuing source of debate within the chiropractic profession as well, with some schools of chiropractic still teaching the traditional/straight subluxation-based chiropractic, while others have moved towards an evidence-based chiropractic that rejects metaphysical foundings and limits itself to primarily neuromusculoskeletal conditions. In 2005, the chiropractic subluxation was defined by the World Health Organization as a lesion or dysfunction in a joint or motion segment in which alignment, movement integrity, and/or physiological function are altered, although contact between joint surfaces remains intact. It is essentially a functional entity, which may influence biomechanical and neural integrity. This differs from the medical definition of subluxation as a significant structural displacement, which can be seen with static imaging techniques such as X-rays. This exposes patients to harmful ionizing radiation for no evidentially supported reason. The 2008 book Trick or Treatment states X-rays can reveal neither the subluxations nor the innate intelligence associated with chiropractic philosophy, because they do not exist. Attorney David Chapman Smith, Secretary General of the World Federation of Chiropractic, has stated that medical critics have asked how there can be a subluxation if it cannot be seen on X-ray. The answer is that the chiropractic subluxation is essentially a functional entity, not structural, and is therefore no more visible on static X-ray than a limp or headache or any other functional problem. The General Chiropractic Council, the statutory regulatory body for chiropractors in the United Kingdom, states that the chiropractic vertebral subluxation complex is not supported by any clinical research evidence that would allow claims to be made that it is the cause of disease. As of 2014, the National Board of Chiropractic Examiners states the specific focus of chiropractic practice is known as the chiropractic subluxation or joint dysfunction. A subluxation is a health concern that manifests in the skeletal joints, and, through complex anatomical and physiological relationships, affects the nervous system and may lead to reduced function, disability, or illness. Scope of practice. Chiropractors emphasize the conservative management of the neuromusculoskeletal system without the use of medicines or surgery, with special emphasis on the spine. Back and neck pain are the specialties of chiropractic, but many chiropractors treat ailments other than musculoskeletal issues. There is a range of opinions among chiropractors. Some believed that treatment should be confined to the spine, or back and neck pain, others disagreed. For example, while one 2009 survey of American chiropractors had found that 73% classified themselves as back pain/musculoskeletal specialists, the label back and neck pain specialists was regarded by 47% of them as a least desirable description in a 2005 international survey. Chiropractic combines aspects from mainstream and alternative medicine, and there is no agreement about how to define the profession. Although chiropractors have many attributes of primary care providers, chiropractic has more of the attributes of a medical specialty like dentistry or podiatry. It has been proposed that chiropractors specialize in non-surgical spine care, instead of attempting to also treat other problems, but the more expansive view of chiropractic is still widespread. Mainstream healthcare and governmental organizations such as the World Health Organization consider chiropractic to be complementary and alternative medicine, CAM, and a 2008 study reported that 31% of surveyed chiropractors categorized chiropractic as CAM, 27% as integrated medicine, and 12% as mainstream medicine. Many chiropractors believe they are primary care providers, including US and UK chiropractors, but the length, breadth, and depth of chiropractic clinical training do not support the requirements to be considered primary care providers, so their role on primary care is limited and disputed. Chiropractic overlaps with several other forms of manual therapy, including massage therapy, osteopathy, physical therapy, and sports medicine. Chiropractic is autonomous from and competitive with mainstream medicine, and osteopathy outside the U.S. remains primarily a manual medical system. Physical therapists work alongside and cooperate with mainstream medicine, and osteopathic medicine in the U.S. has merged with the medical profession. Practitioners may distinguish these competing approaches through claims that, compared to other therapists, chiropractors heavily emphasize spinal manipulation, tend to use firmer manipulative techniques, and promote maintenance care, that osteopaths use a wider variety of treatment procedures, and that physical therapists emphasize machinery and exercise. Chiropractic diagnosis may involve a range of methods including skeletal imaging, observational and tactile assessments, and orthopedic and neurological evaluation. A chiropractor may also refer a patient to an appropriate specialist, or co-manage with another healthcare provider. Common patient management involves spinal manipulation, SM, and other manual therapies to the joints and soft tissues, rehabilitative exercises, health promotion, electrical modalities, complementary procedures, and lifestyle advice. Chiropractors are not normally licensed to write medical prescriptions or perform major surgery in the United States, although New Mexico has become the first U.S. state to allow advanced practice-trained chiropractors to prescribe certain medications. In the U.S., their scope of practice varies by state, based on inconsistent views of chiropractic care. Some states, such as Iowa, broadly allow treatment of human ailments. Some, such as Delaware, use vague concepts such as transition of nerve energy to define scope of practice. Others, such as New Jersey, specify a severely narrowed scope. U.S. states also differ over whether chiropractors may conduct laboratory tests or diagnostic procedures, dispense dietary supplements, or use other therapies such as homeopathy and acupuncture. In Oregon, they can become certified to perform minor surgery and to deliver children via natural childbirth. A 2003 survey of North American chiropractors found that a slight majority favored allowing them to write prescriptions for over-the-counter drugs. A 2010 survey found that 72% of Swiss chiropractors considered their ability to prescribe non-prescription medication as an advantage for chiropractic treatment. A related field, veterinary chiropractic, applies manual therapies to animals and is recognized in 40 U.S. states, but is not recognized by the American Chiropractic Association as being chiropractic. It remains controversial within certain segments of the veterinary and chiropractic profession. No single profession owns spinal manipulation, and there is little consensus as to which profession should administer SM, raising concerns by chiropractors that other medical physicians could steal SM procedures from chiropractors. A focus on evidence-based SM research has also raised concerns that the resulting practice guidelines could limit the scope of chiropractic practice to treating backs and necks. 2 U.S. states, Washington and Arkansas, prohibit physical therapists from performing SM. Some states allow them to do it only if they have completed advanced training in SM, and some states allow only chiropractors to perform SM, or only chiropractors and physicians. Bills to further prohibit non-chiropractors from performing SM are regularly introduced into state legislatures and are opposed by physical therapist organizations. Treatments. Spinal manipulation, which chiropractors call spinal adjustment or chiropractic adjustment, is the most common treatment used in chiropractic care. Spinal manipulation is a passive manual maneuver during which a three-joint complex is taken past the normal range of movement, but not so far as to dislocate or damage the joint. Its defining factor is a dynamic thrust, which is a sudden force that causes an audible release and attempts to increase a joint's range of motion. High velocity, low amplitude spinal manipulation, HVLASM, thrusts have physiological effects that signal neural discharge from paraspinal muscle tissues. Depending on duration and amplitude of the thrust are factors of the degree in paraspinal muscle spindles activation. Clinical skill in employing HVLASM thrusts depends on the ability of the practitioner to handle the duration and magnitude of the load. More generally, spinal manipulative therapy, SMT, describes techniques where the hands are used to manipulate, massage, mobilize, adjust, stimulate, apply traction to, or otherwise influence the spine and related tissues. There are several schools of chiropractic adjustive techniques, although most chiropractors mix techniques from several schools. The following adjustive procedures were received by more than 10% of patients of licensed U.S. chiropractors in a 2003 survey: diversified technique, full spine manipulation, employing various techniques, extremity adjusting, activator technique, which uses a spring-loaded tool to deliver precise adjustments to the spine, Thompson technique, which relies on a drop table and detailed procedural protocols, Gonstead, which emphasizes evaluating the spine along with specific adjustment that avoids rotational vectors, Cox/flexion distraction, a gentle, low-force adjusting procedure which mixes chiropractic with osteopathic principles and utilizes specialized adjusting tables with movable parts, adjustive instrument, sacro-occipital technique, which models the spine as a torsion bar, pneumoreceptor tonus technique, applied kinesiology, which emphasizes muscle testing as a diagnostic tool, and cranial. Chiropractic biophysics technique uses inverse functions of rotations during spinal manipulation. Corin-specific technique, KST, may use their hands, or they may use an electric device known as an arthrostim for assessment and spinal manipulations. Insurers in the US and UK that cover other chiropractic techniques exclude KST from coverage because they consider it to be experimental and investigational. Medicine-assisted manipulation, such as manipulation under anesthesia, involves sedation or local anesthetic and is done by a team that includes an anesthesiologist. A 2008 systematic review did not find enough evidence to make recommendations about its use for chronic low back pain. Many other procedures are used by chiropractors for treating the spine, other joints and tissues, and general health issues. The following procedures were received by more than one-third of patients of licensed U.S. chiropractors in a 2003 survey: diversified technique, full spine manipulation, mentioned in previous paragraph, physical fitness/exercise promotion, corrective or therapeutic exercise, ergonomic/postural advice, self-care strategies, activities of daily living, changing risky/unhealthy behaviors, nutritional/dietary recommendations, relaxation/stress reduction recommendations, ice pack/cryotherapy. Extremity adjusting, also mentioned in previous paragraph, trigger point therapy, and disease prevention/early screening advice. A 2010 study describing Belgium chiropractors and their patients found chiropractors in Belgium mostly focus on neuromusculoskeletal complaints in adult patients, with emphasis on the spine. The diversified technique is the most often applied technique at 93%, followed by the activator mechanical assisted technique at 41%. A 2009 study assessing chiropractic students giving or receiving spinal manipulations while attending a U.S. chiropractic college found diversified, Gonstead, and upper cervical manipulations are frequently used methods. Practice guidelines. Reviews of research studies within the chiropractic community have been used to generate practice guidelines outlining standards that specify which chiropractic treatments are legitimate, i.e. supported by evidence, and conceivably reimbursable under managed care health payment systems. Evidence-based guidelines are supported by one end of an ideological continuum among chiropractors, the other end employs anti-scientific reasoning and makes unsubstantiated claims. Chiropractic remains at a crossroads, and that in order to progress it would need to embrace science. The promotion by some for it to be a cure-all was both misguided and irrational. A 2007 survey of Alberta chiropractors found that they do not consistently apply research in practice, which may have resulted from a lack of research education and skills. Effectiveness. There is no good evidence that chiropractic is effective for the treatment of any medical condition, except perhaps for certain kinds of back pain. Generally, the research carried out into the effectiveness of chiropractic has been of poor quality. Numerous controlled clinical studies of treatments used by chiropractors have been conducted, with conflicting results. Research published by chiropractors is distinctly biased. For reviews of SM for back pain, chiropractic authors tend to have positive conclusions, while others did not show any effectiveness. There is a wide range of ways to measure treatment outcomes. Chiropractic care, like all medical treatment, benefits from the placebo response. It is difficult to construct a trustworthy placebo for clinical trials of spinal manipulative therapy, SMT, as experts often disagree about whether a proposed placebo actually has no effect. The efficacy of maintenance care in chiropractic is unknown. Available evidence covers the following conditions. Low back pain. A 2013 Cochrane review found very low to moderate evidence that SMT was no more effective than inert interventions, sham SMT, or as an adjunct therapy for acute low back pain. The same review found that SMT appears to be no better than other recommended therapies. A 2016 review found moderate evidence indicating that chiropractic care seems to be effective as physical therapy for low back pain. A 2012 overview of systematic reviews found that collectively, SM failed to show it is an effective intervention for pain. A 2011 Cochrane review found strong evidence that suggests there is no clinically meaningful difference between SMT and other treatments for reducing pain and improving function for chronic low back pain. A 2010 Cochrane review found no current evidence to support or refute a clinically significant difference between the effects of combined chiropractic interventions and other interventions for chronic or mixed duration low back pain. A 2010 systematic review found that most studies suggest SMT achieves equivalent or superior improvement in pain and function when compared with other commonly used interventions for short, intermediate, and long-term follow-up. Specific guidelines concerning the treatment of nonspecific, i.e. unknown cause, low back pain are inconsistent between countries. Radiculopathy. A 2013 systematic review and meta-analysis found a statistically significant improvement in overall recovery from sciatica following SM, when compared to usual care, and suggested that SM may be considered. There is moderate quality evidence to support the use of SM for the treatment of acute lumbar radiculopathy and acute lumbar disc herniation with associated radiculopathy. There is low or very low evidence supporting SM for chronic lumbar spine-related extremity symptoms and cervical spine-related extremity symptoms of any duration, and no evidence exists for the treatment of thoracic radiculopathy, whiplash and other neck pain. There is no consensus on the effectiveness of manual therapies for neck pain. A 2013 systematic review found that the data suggests that there are minimal short and long-term treatment differences when comparing manipulation or mobilization of the cervical spine to physical therapy or exercise for neck pain improvement. A 2013 systematic review found that although there is insufficient evidence that thoracic SM is more effective than other treatments, it is a suitable intervention to treat some patients with nonspecific neck pain. A 2011 systematic review found that thoracic SM may offer short-term improvement for the treatment of acute or subacute mechanical neck pain, although the body of literature is still weak. A 2010 Cochrane review found low-quality evidence that suggests cervical manipulation may offer better short-term pain relief than a control for neck pain, and moderate evidence that cervical manipulation and mobilization produced similar effects on pain, function, and patient satisfaction. A 2010 systematic review found low-level evidence that suggests chiropractic care improves cervical range of motion and pain in the management of whiplash. Headache. A 2011 systematic review found evidence that suggests that chiropractic SMT might be as effective as propranolol or topiramate in the prevention of migraine headaches. A 2011 systematic review found evidence that does not support the use of SM for the treatment of migraine headaches. A 2006 review found no rigorous evidence supporting SM or other manual therapies for tension headache. A 2005 review found that the evidence was weak for effectiveness of chiropractic manipulation for tension headache, and that it was probably more effective for tension headache than for migraine. A 2004 Cochrane review found evidence that suggests SM may be effective for migraine, tension headache, and cervicogenic headache. Extremity conditions. A 2011 systematic review and meta-analysis concluded that the addition of manual mobilizations to an exercise program for the treatment of knee osteoarthritis resulted in better pain relief than a supervised exercise program alone, and suggested that manual therapists consider adding manual mobilization to optimize supervised active exercise programs. There is silver-level evidence that manual therapy is more effective than exercise for the treatment.
Please subscribe and thanks for watching.